Hi, welcome. Welcome everyone that's watching with us today to another episode of Blue Mirage's series Beyond Beauty. This is episode 3, and we'll be seeing a live chemical peel today. Okay, just let me grab the specific. Hold on. Okay. Alrighty. Okay. So the P2 system or the P3 system is what will be used today. And we're just going to give you some information about what exactly this is. So before receiving the P2 system or the P3 system, patients are responsible for informing their skincare professionals about any topical and or oral medications or health conditions that may affect this procedure. Clients must seek medical release clearance before any aesthetic or medical procedure is considered. The following conditions will exclude clients from receiving a Prodigy Peel P2 system or a Prodigy Peel P3 system procedure, unless indicated otherwise, of course. Pregnant or possibility of being pregnant, nursing or breastfeeding, active cold sores, herpes type 1 or 2, or warts in the treatment area, wounded, sunburned, excessively sensitive skin, a history of allergy and sensitivity to any of the ingredients in the Prodigy Prep, Prodigy Peel Pro, and or the Prodigy Boost, allergy to aspirin or salicylates, allergy to idebenone and vitiligo. Any history of autoimmune diseases included psoriasis, lupus, rheumatoid arthritis, dermatomyositis, multiple sclerosis, or any medical issues that may weaken the immune system. Any history of any diseases of immune deficiency, inflammatory dermatitis conditions including rosacea, seborrheic dermatitis, systemic lupus, erythematosus, or dermatomyositis. Right. Hyperpigmentation related to the prior use of hydroquinone containing products, and this is something that is very common. Before the procedure, however, 48 hours before receiving the Prodigy Peel system is required to avoid the following: neurotoxin treatments, example Botox, Xeomin, and Diaspor, etc. If the patient has a history of facial cold sores or herpes type 1 or 2, then the treatment will be inappropriate. Then the prophylactic treatment would be appropriate for this. 1 week, so we're going to give you guys intervals before the procedure is done of stuff that you need to do. 1 week before receiving the Prodigy Peel system, please avoid the following: waxing, depilatory creams, no skin products prepared on 100% alcohol base such as Cleocin, topical, antibiotic in an alcoholic solution, exfoliating, and using retinoids such as retinol A. 1 month before receiving the Prodigy Peel, there should be absolutely no chemical peels, microneedling, non-ablative resurfacing treatments, some ablativeness, such as fractional lasers, etc., per the skincare professional assessment. 6 months before receiving the Prodigy Peel, you are required to avoid the following, such as facial surgery: 1 year before receiving the Prodigy peel, please avoid the following, such as Accutane and chemotherapy. You should also avoid the application of pressure. Pressure controls the depth of the chemical peel, and applying with excessive pressure can cause deeper peeling, irritation, and longer healing time. So it is recommended that whoever is applying this, mind you, it should be a professional, a certified professional. They should use light hands. A patch testing, before this procedure can take place, a patch testing should be done for the first time, and we strongly advise to test the patch before the full treatment is applied. Spot treatment near the ear or inner arm. If excessive flaring happens, or burning or itching occurs, do not continue with this procedure. Any reaction should be noted within 24 hours of application. But like I said, guys, this procedure is best done by a certified professional so as to avoid these things happening. So safety precautions, it takes me into safety precautions. A licensed skincare professional should ensure that the P2 or P3 systems are within listed expiration date before application of the chemical peel. The systems should be stored under the manufacturer's guidelines. Water should be easily accessible in the event of an emergency. All clinical staff should be trained on safety procedures, and patients are required to wear eye goggles or patches during the preparation of and application of the chemical peel. Chemical peel solutions should always be prepared and poured on a stable surface away from the patient to avoid spilling on the patient. After each pour, caps should be secured firmly to avoid spillage. Facility and treatment area should always comply and meet OSHA's requirements. Okay, so some common skin reactions that could happen from using the peel. You could experience mild tingling, itching, dryness, and mild tightness. So it's recommended that you were consuming, a good amount of water prior to your sessions to avoid all this happening. Okay, so the clinical P2 system must be administered, like I said earlier, by a professional, personnel in a medical or clinical environment that is compliant with OSHA's regulations. Only licensed skincare professionals working within their licensure can render this P2 system. Medical supervision is recommended and may be required depending on your state's law. So the hair is recommended to be covered, cleanse thoroughly, cleanse the skin or the area wherever this procedure will be focusing on, or a gentle pH balance cleanser, and rinse with water and gently pat dry. So step 1, we're going to be doing this in steps, guys, so I hope you are paying attention and taking notes if necessary. So step 1, the Prodigy Prep Toner. The application, pour approximately 4 ml of the Prodigy Prep solution into a clear plastic cup provided, whatever container that you have at your medical facility. All of this was done by Dr. Stevenson behind the scenes.
All right, thank you so much, Courtney.
Okay,
so we're going to start our procedure. Here we have our client. Our client is a male client, and his main concern is hyperpigmentation in his cheek area.
Mm-hmm.
So that is his main concern that he's having. He does have some hyperpigmentation in the forehead. He had received one peel 4 weeks ago, which is about a month ago, and he's now here for a second peel. Sometimes what I do with the clients is that I would not repeat the same peel. I would combine other peels to try to get him to have the best results as far as his peels are concerned. So what I'm gonna do is I'm gonna cover his head and I'm gonna cleanse his face. He doesn't really have to have his head covered because he doesn't really have like a lot of like hair is gonna get into the way. The goal is that you don't really want to put the peel on someone's hair. So you want to make sure that the hair is covered. If they don't have any hair, then it's not really like that important that you cover the head. So what I'm gonna do now, I'm gonna wash his face. I always wash. I'm using the Project P, the P2 system. This particular peel is ideal for your Fitzpatrick 4 to 6 clients. So this is like your olive color, your Asians, your Hispanics, your African Americans, your Black African client, your Mediterranean clients, your Italians, and all of the Middle Eastern clients. This is the ideal peel for this particular skin types of clients. Okay. So as I said to you, I like to use the Clinical Cleanser. It's very mild, and you can use this cleanser almost on any skin. There's no irritation. It's not very sooty, and but I mean sooty is not very soapy. So there's not like a lot of residuals for you to be removing once you use this particular cleanser. So I'm going to cleanse his face. Because the goal is that I want to remove all of the oil or any products that he has placed on his skin before he comes in. What I normally tell my clients before they do a peel is to come in with a clean face. So they need to wash their face and not have a lot of products on their face, which makes it a lot easier when you're doing the peels. Okay? And then we're just gonna take it off.
And you see how she's wiping the neck area as well, guys. That is also a part of taking care of your face.
Exactly. So there is a protocol for when you're placing a peel on a client. Ideally, you also want to start with the forehead. And the reason why you want to start with the forehead is because the forehead is a lot thicker, or sorry, a little bit more sensitive than the mid face. So if there's an issue or concern as far as a patient having any discomfort, they're going to feel it on the forehead. The neck you always want to do last because the neck is more sensitive than every other part of the face.
Okay.
Okay. So the forehead first, because you can tell tolerance based on the client based on that. So now his face has been cleansed. And what I normally do now, I always cover the eyes. So I'm going to take some eye patch because we don't really want to have any peel fall into the client's face. Are you comfortable? So with my eye patch, because they're dry, I always like moisten them.
What do you moisten them in?
And with water. So I just put a little tap water and moisten them, not dripping wet, and then I just place them over the eyes. Now, typically, I do not really start my patient this flat because I also don't want to get the peel into the client's eyes. So normally I have them upright a little bit more than how I have them right now. But because I want to reach the neck, I have them this way because I really want it to be like sniffed up. I have a pillow under his head. So when I'm done, I'm going to remove that pillow so I can get really under the neck and do like a good job as far as his peel is concerned.
Okay.
Then I take petroleum jelly or Vaseline, and I'm going to cover the areas that tends to burn. Even though the peel is not going on his lips or on his nostril, I still cover it because it does trickle down a little bit, and the patient may have a little bit of discomfort. So I cover the lips and the tip of the vermilion border, because that's where people tend to burn, feel the peel. I also cover the nostrils, okay, with the peel. So people
That's
get burn
smart.
around that area. And then I cover the earlobes. So to make sure that the peel drips is not gonna irritate his earlobes.
Okay.
I do both sides. And then I'm gonna still like just formulate his forehead area. Like I said, he doesn't really have, there's not like a lot of like here it's gonna get in my way. But I just want to just make sure that it gets to where I want to treat it.
Okay, so like a controlled.
And I think that's all. And if they're burning while you're doing it, you can just add more petroleum jelly, Vaseline. Okay. And because I just use the petroleum jelly, my glove is a little bit like greasy, so I'm gonna take it off. Okay. And then I'm gonna replace it with another glove to get started. Just to mention to you that for this peel, sometimes it burns, so I always have a bucket or a little like basin with ice water and little ice cubes in it, so that if he burns, I can just take some wet gauze and just calm the skin down. And also, I always hand the client a fan. Okay, so you can hold the fan in your hand. Okay, you don't have to turn it on yet because we're not ready to do that part yet. So then I'm gonna re-put on my gloves. So for this particular peel, it's 3 steps. So in the first step, I am going to pour in 4 mLs, which is 4 milliliters of the neutralizing solution. And I have these little Petri little cups. So there's a measurement that tells you how much you should be putting in. I just use a syringe just to make sure that I'm getting the right amount. Okay, so for each of this section, for step 2 is 2 ml, for step 3 is 2 mLs. So we're gonna first start off with the prep solution. So this is 4 mLs. So this syringe is a 3 ml syringe. So I got like 2.5, and I'm gonna do another 1.5. That's my 4 ml. Okay, and then for number 2, I'm going to take up my 2 mLs. Sometimes you can't get all of it in, so that's why I have the little needle points to help me.
Okay.
I like to pour because sometimes it's not exact. So I just make sure that I get like 2 mLs of the peel. And the reason why I have these syringes and I have them labeled, because I don't really want to mix the solutions.
Right.
So that's like why I just make sure that I'm using them appropriately. Now there's 2 ways that you can do the peel. I like to use the woven gauze, and the reason why I like to use the woven gauze is because the woven gauze will suck up less of your peel. The non-woven is a little bit softer and it will suck everything up. It doesn't really matter which way you choose. It's just my preference. And also too, because you want to make sure you're applying a light pressure that is not too much. This would give you like a little bit of a little edge of getting the peel onto the skin. The peel should be wet but not dripping.
Okay.
Okay, so now we're just gonna just put on, as I told you, this is just the prep.
Okay, so step 1.
So sometimes the patient may go, oh, it's running down in my face. It's just a prep. So it's not doing anything. There's alcohol in it, so they smell the alcohol. So they may think that that it's running down on them. It's really not. Okay. And because this is a little bit cumbersome with him, I'm gonna stop for a second, and I'm gonna put some Vaseline on the eyebrows, and I'm gonna hold off my pads for now. If I need to use them, I will do it. So normally what I do is I also line the eyebrows and then I just cover his eyelashes with the peel, so that if it drips down, I have a barrier, and when I'm done, I'll wipe it off.
Oh, you cover those with the Vaseline as well?
Right, because this is the barrier. So if the peel drips, it's gonna go right over the Vaseline. It won't soak into the skin.
That makes sense.
So that's why some people don't like to have them laying down, because then that gets into your way as you're doing the peel. So you're trying to avoid, things dropping as you're trying to do your peel. Okay, so we're gonna continue with the prep. Okay, so the forehead, and this is just making sure that all the skin is prepped, that all of the oil that is just left on his skin comes off. That way he has a nice, good peel.
Okay, so I guess having residue, sweat and dead skin and all that backed up on the skin would affect how well the chemical peel turns out.
What you want to do is you want to make the skin as smooth as possible, and as less if there's any product left after you cleanse the skin, this would help it where it comes off. It's a neutralizer. It's preparing the skin for the peel.
Okay.
And you're correct, even though that's not what they say. Because this is not my product. This is clinical. We have to follow their protocol, but it is an antiseptic, even though that's not what they're saying. It's a neutralizer, but you're correct. There's antiseptic property, which kind of like numbs the skin and prepare the skin for the peel. So that was a very good catch that you just mentioned. And if you look with the woven gauze, you can just see that, it's not. It does give you that little moisture, which is what you want.
Yeah.
This is just the prep, as I told you. And as you can see, even though I just cleansed his skin, and there's still little bacteria still left on his skin, so I had a little bit of debris still on the skin. So that's why you can never be too.
I think I can kind of see the hyperpigmentation that you were mentioning earlier.
Yeah. So with a client like this, he is going to need multiple sessions of peel. So it's not like a 3 peel, but there are people who have a 3 peel and they do really well, and then you can dry Junior with the fan. And there are some people who have more pigmentation and they do well. So there's really no gauge to say you're gonna need 5 peels, you're gonna need 6 peels. It's a reassessment every time you come in for your peels.
Okay, and I'm guessing your skin type has something to do with that as well.
It has to do with the type of sun damage that you have had to your skin. There are people who are very, very dark and they have the most beautiful skin. There's nothing. So it's all about how much sun damage you have had. Okay, so now this is step 2. This is the peel that I'm starting on with them. Okay, so I'm gonna. Okay. As I told you that I'm using this gauze because the other peel will suck up a lot of the peel, and I really don't want to do that.
Yeah.
Okay, so I'm gonna start with the forehead. And then I always ask for the person to tell me the level of discomfort. 1 to 4 is like mild. Anything after 4 is moderate, and 9 to 10 is severe of discomfort as they feel. Okay. So you want to go in the pattern so that way you don't miss any area of the skin. And I'm going to do his neck last because close your lips for me, because that's the area that tends to be the most uncomfortable. And you can do 1 to 3 passes with this peel. Any discomfort? Number 1. All right. So as I explained to you that he has hyperpigmentation, so I already did his entire face. So what I normally do, I just go back into the area where I'm trying to make sure that he gets the most. And this is a medium pressure. It's not like a scrubbing pressure.
Okay.
You do want to wait a few minutes in between. You just don't want to just keep applying the peel onto someone.
Mm-hmm.
And the gauze is still wet. So that's what you see. I'm still passing because the gauze is still wet. And that's why I like this gauze for that reason.
Okay. Oh, so basically you get to use the product more on the patient's face rather than it's just sucking up everything.
Exactly. So that was one pass. So then I asked him how he's doing, and then I will start with the boost, which this is just gonna ensure that I'm gonna need more of these gauze. Did you cut more? No? Okay. So now this is the boost. This is just to ensure that the peel gets in.
Okay, and is the boost still in step one?
As you can look at his skin, you can see that he's getting like a little bit frosty in this area, so which is good. So that means any discomfort in the forehead? No? Okay, which is good. So that means that he got the full penetration of the peel in those areas. As you can see, it seems as though I don't have a lot on the gauze, but in reality I do.
Mm-hmm.
Okay.
I was asking if the boost is still in step one.
Yes.
Okay.
No, this is step 2. This is step 3. So the boost is just to make sure that what I just did get fully penetrated into the skin.
Okay.
So this is all pass 1. So that's one pass of the peel that he got just now. I don't like to finish the whole thing.
Okay.
Any discomfort? Okay, so that was pass 1. So I'm going to prep again. So when I do pass 1, the next step is going to go 2, 3. So I don't go back again to the neutralizer. So I'm just going to continue now with step 2 again. So that was 1 pass. The last pass I will just make sure that he gets it on the neck. So this pass, this 2 ml pass, we're going to go back again onto the face. But I may focus more on the areas where I see the most hyperpigmentation that I'm really trying to tackle.
Okay. Quick question though. The frosting that happens, would you say it happens on the problematic areas or it can happen anywhere on the skin?
What you talk about the frosting?
Yeah.
No, the frosting just means that the skin has gotten enough peel. It doesn't matter what area. Some part of your skin is a little bit more sensitive, mm-hmm. and the peel penetrate faster in those areas. So it's not about the pigmentation; it's about how your skin is responding to what I'm doing.
Okay.
Okay, so we're gonna go back again to step step 2. Okay, so the frosting is gone. So it's not even severe. So we're going to start over again. But this time around, because as I explained to you, I'm going to try to hit the areas that he has concerns with, which is the cheek area.
Okay.
And then I'm going to go up to the forehead now that I've already covered what I wanted to cover. So now I'll do the forehead. So in addition to my client receiving the chemical peels, he's going to also need to get some facials. So I also recommend that he comes in like about 2 weeks after his peel, and then we're going to do some facials on him, okay. To help him. Mm-hmm. And then he also has some pigmentation cream that I also suggest that he also utilizes. So,
yeah. So for the post, I guess you're talking about the post care.
no, we haven't. No, the post care is quite easy, but we haven't gotten to that part yet. This is the easy post care. Most of the peels have a lot of steps. This one is just cleanse and using something that's called Pro Shield, which I have on the desk over there. So we'll come back to that in a few minutes. And then sometimes too, the peel can like burn your gloves. So some people they double gloves because it does get a little irritating, and then it does kind of like. Okay, this is the boost. So typically, I've taken care of this client before. So typically, you want to give them time for the peel to penetrate before you just keep going, because once it starts to burn, it's a little bit uncomfortable for them. And as you can see, I'm not following the regular pattern because, like I said, I've taken care of him before. Yeah. So it's forehead, then lower face, then mid face, and then lower face. Okay, because I'm just trying to hit what what his complaint areas are. And typically for men, I like for them to come with a very clean face, which he pretty much has. Try to like shave because I don't want you shaving while you're peeling.
Okay, so
this not be shaving for the next 7 to 10 days.
Okay, so this procedure is it more difficult if they have a beard or? Well,
if they have a beard, you're not gonna put the peel, so the peel's only gonna cut the skin. So there are a lot of men who wear beards, and they do have pigmentation issues. So yes, they should really not have, you should not be putting the peel in someone's beard if they have a beard. You want to avoid it. So that was 2 passes, and he's doing quite well. This is the last of the peel. So now we're gonna focus on his neck area, okay? Which he doesn't really have much pigmentation here on the neck. As I told you, the peel needs to be wet, okay? Not soaking wet, but it should not be dry.
Okay.
And if you notice, I'm like making sure that I don't put the peel over his face because I don't want the peel to drop into his into his face. And I have some more left, so I'm going to go back again over those little areas of pigmentation that he has that I'm trying to treat.
Okay.
Any burn? One. He's really good. He's a very good client. So what I normally do, since I have any of it, I just kind of just make sure that I just dab all of it into the skin. This non-moving gauze, keeps a lot of the peel in it.
Okay.
Okay, and then we're gonna finish up with the boost. So let me see if I have any more boost in any of the ones over here because I need a little bit more boost. It's not that one, so I'm just using this one. A little bit more boost. Sometimes you may, I don't know how they calculated it correctly, but we're not boosting that one. So I do need at least 2 mLs. So that's why it's always good to have like extras. just have to go get another one. So I'm just gonna use the rest of the boost that I have left here. I do have 2 bars of boost. All right, so this is the last part of to get the product into the skin. Oh, it's still good. All right, excellent.
Quick question. You mentioned earlier that you recommend the clients having facials done after their peels.
About 2 weeks after. It's my way of assessing the skin and to do more education, because some patients, they will have a peel and then they will start to go back to like bad routine or cause irritation of the skin. Okay. And this is how I catch issues and we can address them.
Okay, so it's sort of like a way to maintain the fresh, the new skin that the chemical peel helped to achieve.
Actually, it is to enhance the peel and make sure that they follow the instructions.
Okay.
As I said, some people they don't understand, so they'll go and get a peel and then they go back to using products that's going to cause either pigmentation, irritation of the skin. So all they're going to do is they're going to cause problems, complications.
Okay.
Remember, this is a medical grade peel, so this is a deep peel. So it's not a superficial peel. So you want to just make sure. So that's pretty much it, and he's pretty much done. Okay, so after he's done with this, now what I'm going to do is I'm going to take away the Vaseline from his eyes. And then just take it off the ears. I like to keep the nose and the mouth Vaseline on, because some people tend to have like irritation on the lip area even after the peel is done. So I just like to leave it on. Then what I ask them to do is kind of just dry themselves off, and this will give me some time to reassess them. So normally when I'm done with the peel, I keep my clients here for a good 30 minutes just to reassess them.
Okay.
Okay. Because the peel is now taking effect. So me applying the peel, they may not have, so they are burning, but an hour or 2 hours later they may. So I would know within 30 minutes how severe their discomfort is going to be. So that's why I like to keep them here for about 30 minutes. Okay, so as you had mentioned before, we do have post-care recommendation.
Right.
So after the peel, it is recommended that within 4 hours that the client wash their face. Okay, so you wash your face, and then we have something that's called Shield Balm Recovery Cream. So we use the cleansing complex, okay, which we sell to the clients. Before they leave, you just need a small drop of this. I think sometimes we tend to like overuse products. It's a very small amount to cleanse the face. You dry your face, don't rub it, and then you apply the Shield Recovery Balm. Okay. So typically you should start to see a peel within 3 to 5 days. Some people sooner. Whenever I've ever gotten a peel, like within 1 to 2 days, my skin will just turn really dark, and then it starts to shed. Some people may not see that, so there's not one thing that fits all. We all are different, so our skin is going to respond differently to the products that we use on people's skin. So don't go, my friend's skin turned black and she peeled in a day, and I got a peel and nothing happened. Some of us shed very lightly, especially people who do a lot of skin maintenance, like facials. They may not tend to peel as heavily as someone who doesn't get a lot of facials. Because remember, if you're getting facials, every time you get facials, there's exfoliation. Someone is manually helping you remove dead skin. So there's not a lot of dead skin there. So when you get the peel, you may not peel as heavily as someone who's not maintaining their skin the way you're maintaining your skin.
Mm-hmm. That makes perfect sense, actually. And patients should also avoid, sun exposure and following
Exactly.
the application of the Extreme Protect SPF 30 or Eclipse SPF 50. No other product should, be applied to the face until the evening. So it's best to get a peel closer to the evening because you have to wash the chemicals off your face at least 4 hours before bedtime, like Dr. Stevenson said earlier.
Okay, and also sunscreen. So we sell a host of sunscreen here. So you have opportunities. We have Pravonia line, we have Iskenica line, we have Isden, we have Skin Medica. So there's a numerous amount of of sunscreen that you can utilize to help protect your skin. So always wear sunscreen. Even after you use the Shield Recovery Balm, this balm, the reason why this peel recommended is that your face should never get dry while you're getting the Project Peter 2 system. It should always be well moisturized. Mm-hmm. You get a nicer peel. And do not pick your skin when you're peeling because that will cause you to have hyperpigmentation. Mm-hmm. Also, to remember that some of our Fitzpatrick skin types, such as our 4 to 6, they may also got something that's called PIH. It's called post-inflammatory hyperpigmentation, hyperplasia. That happens because that is how our skin behaves. You may get darker around the neck area or some part of the skin, but over time it's going to go away. It's temporary. So some people get peeled. They go, "Oh, I never get peeled because I got dark." It's a temporary process that happened to me when I had my peel. My neck turned really dark, and it does make you feel uncomfortable. But if you just continue to follow the protocol, hydrate, moisturize, sunscreen, it goes away. Okay? And you can also repeat the peel. That would also help with the hyperpigmentation with the PIH as well.
Okay. And also, not only should, clients avoid overly exposing themselves to sun, patients should avoid hot baths, saunas, excessive sweating, vigorous exercise, and or tanning beds for 10 days post your chemical peel.
Exactly. And the reason why is that? The reason is that there's bacteria. As you're peeling and you're sweating, you're going to be prone to have a lot of bacteria. So the goal is that we want to have a clean medical grade peel. So we want to limit the amount of bacteria that you've been exposed to. You go to a gym and there's other people there, so you're also coming into contact with their bacteria. So we're trying not to have an infection. We're trying to have you have a medical clean chemical peel without infection.
Okay, that makes perfect sense actually.
And then sometimes too, people when they exercise, they leave with the same clothes. So now you have bacteria. So we're trying to prevent bacteria.
Okay. Also, they could, change their pillowcases and stuff like that too prior to their session. So when they go home and they're recovering, like you said, everything will be clean and, they'll have a good recovery.
Exactly. So I always recommend that any facial procedures that you get at Blue Mirage Aesthetics, whether it's a chemical peel, whether it's a facial, whether it's a body treatment, whether it's PRP, skin pen, I always recommend that your bedding is changed. If you can't change your bedding, then you can cover your bedding with a clean towel.
Okay.
And then try not to use the same towel that you're using your body on your face.
Okay? Definitely. So,
are we having any questions coming in or
questions from our viewers? And remember that if you're not comfortable putting your questions out there on the live, you can always send us an email, visit our website, or give us a call. Doc, could you tell them the phone number?
Number 1 still? Excellent.
I was saying to them that you could, they could reach out to us if they're uncomfortable putting their questions out there in the comment section. Could you tell them the BMA phone number?
So the BMA phone number is 862-223-8449. That phone number you can text, you can send us pictures, you can email us, and you can leave voicemail. And as far as emailing us, you can email us at info@bluemirageaesthetics.com. And we'll also get back to you.
Right, and you can visit our website at www.bluemirageaesthetics.com, and in the booking sections you can see all the available peels that we have. So
okay. And also try to follow us on Facebook and on our Instagram for our weekly live commentary about our services at BMA.
Right, and this is only episode 3, guys. If you've missed the previous sessions, you can always go back and visit our Instagram page and have a look. Is there any questions from our viewers at the moment, like we've asked earlier? Anything from what you've seen earlier from Dr. Stevenson here on her client? Well, if we don't have any questions, we can just move along. And I really just want to thank everyone for coming out with us on another episode of Beyond Beauty. A heartfelt thank you to Dr. Stevenson for sharing her expertise as usual. Us here at BMA, we have a transparent vibe about us. We don't gatekeep anything, really. We're here to empower you through education and information. So stay connected with us here on Instagram. Hit the notification bell if you're not already. Like she said, follow us on Facebook and YouTube at Blue Mirage Aesthetics. Remember, beauty is not just skin deep. It's about feeling confident and empowered in your own skin. So until next time, let's continue exploring beyond beauty together. Thanks again for this session. It was very informative. I think I need myself a peel as well.
All right, thank you and have a good night.
Okay. Bye, guys.
Okay, bye-bye.